We are at the 2024 Delegates Conference and we do have the new Health Minister, Jacquie Petrusma, with us.
Good morning, Esther. It's absolutely fantastic to be here this morning.
The new Health Minister, is that a bit daunting? It's a big role. It's a huge role. How do you feel taking over that portfolio?
I'm actually very, very excited about the new role. I was, 40 years ago in August 1984, I started my nursing training at the Launceston General Hospital. So I've now been in health or health-related areas for 40 years. So people now think I'm very, very old. But I love health. Health's always been my passion. It's where I've always worked. I've worked at the Launceston General Hospital, the Northwest Regional Hospital, the Royal Hobart Hospital, King Island District Hospital. I've worked in child health, aged care, driven ambulances on King Island. So I've got a vast array of experience and also sold drugs legally as a pharmaceutical rep. National sales manager. So I've got just a wide range of experiences that I can reflect on, especially in my new role, because I am really passionate about building a better health system and making sure that we do put our people first. And that's why, I want to recruit as more doctors, nurses, paramedics, cleaners, allied health professionals as quick as we can, as soon as we can, so that they're on the, working on the ground as soon as we can. So recruitment's a really big push for me, and I'm delighted to say that we've recruited over 1,000 new people since April this year.
Where do you think previous health ministers, and not even party aligned, but have failed? Because it seems as though, and I've spoken with so many delegates here, and I know that you're going to speak with the delegates too, which I think is amazing. But where have we gone wrong, and what do we need to fix it?
What we need to fix it is also to ask the federal government to pay their fair share. For example, the federal government in our hospital system is supposed to be paying 45% of the budget. At the moment, they're only paying about 41% of the budget. Now, that difference of about 4% equals about an extra $80 million that this state government has to put into services. They're also supposed to be looking after primary care services, but we're finding more and more that we have to step up in regards to GPs. But GPs are a federally funded action, and federal government is supposed to be looking after GP services, but they're setting it up for market failure. There's a lot of thin markets in Tasmania when it comes to GP services. So we're really calling for all parties so that we can take a Team Tasmania approach and ask the federal government to step up and fund services as they're supposed to, so that we have extra funding at a state level so that we can deliver better services for Tasmanians. 5
health ministers in 5 years. Is this a role? Why do you think there has been such a high turnover? And do you think hopefully you won't be 6 in 6 years?
Oh, I definitely intend to be here until we go to the next election in over 3 years' time. Health is my passion, it's my purpose, it's what I've always been wanting to do, and I'm so excited that I've got the opportunity now to have the health portfolio.
Speaking with both the Greens and Labor who have attended here, they both said that they'd be very keen to work with you and have high hopes. Are you open to those conversations?
Oh, definitely. I've with both Ella Haddad and Cecily Rosell, I've got a really high admiration for them and their abilities. And I've already said to Ella that if any time she's got any great suggestions, if she doesn't mind, I might take them on board as well. But in the past, I've always worked collaboratively with both Labor and the Greens. For example, in family violence, I worked with Cassie O'Connor and Lara Giddings in getting up our first tripartite motion in Parliament to say no more to family violence, which then led to us getting our first state-based family violence and sexual violence action plan. So I do welcome the opportunity to work collaboratively with both Labor and the Greens, and I look forward to a Team Tasmania approach, because I think together we can achieve so much more than playing politics over health, so that we can ask the federal government to step up and play their fair share in funding the services that they are responsible for, so that we can deliver the services that at a state level we are responsible for.
HACSU has, of course, over 11,000 members and over 400 delegates across the state. And one thing I've heard from them a lot is they don't see much of a government presence. And so you being here to speak with them, I know is going to be, it means a lot for you to be seen and heard. Could we perhaps also invite you to our annual HACSU Health debate?
Well, I'd definitely love to consider going to the health debate. It's I believe it's only through working together collaboratively, but also more importantly listening to what is happening on the ground. While I do have a health background, I don't know everything about what's happening on the ground now. So the reason I'm here today is to hear frank and fearless advice and also, feedback on what is actually happening on the ground. And that's what I really want to hear. I'm here to listen and to learn, and they have the opportunity to educate me up.
Thank you so much.
Thank you. Thanks, Esther.